Okay, so let's talk about the metabolic alkalosis right now. So with a metabolic problem, the problem is not with the lungs, okay? It's a problem, somewhere else. So this can be caused by drugs, this can be caused by an endocrine disorder, this can be caused by diarrhea, anything that'll change the acid-base balance in your blood. Okay, so with a metabolic problem, your lungs work fine. Okay, so with metabolic alkalosis, your body has too much bicarbonate, and this often happens if your body loses too much acid. So the ratio of bicarbonate to acid increases too much, and your bicarbonate concentration increases. Two classic examples of this are vomiting and antacid use. So if you're vomiting, all the hydrochloric acid in your stomach is leaving your body. Okay, so the concentration of bicarbonate is going to increase. If you're using too many antacids, your body isn't making antacids in your stomach, and the concentration of bicarbonate to acid is going to increase, okay? And, your bicarbonate level will, increase by definition. Now, the loop diuretics and hyperaldosteronism, I think these two are interesting to understand, and I can explain it to you in a few minutes in another video if you'd like. So, with metabolic alkalosis, okay, because it's an alkalosis, your pH is going to increase, okay? And because your lungs work fine, you're still going to have your normal concentration of CO2 in your body, which is 40 initially, okay? So with metabolic alkalosis, the line is going to go, let's say, right here. So your plasma, okay, bicarbonate has increased, but your plasma or partial pressure of CO2 has not changed because your lungs are working perfectly. Now, after a little while, your lungs are going to compensate for the metabolic alkalosis, and your lungs can start compensating a lot quicker than your kidneys can. So, we already talked about any line like this is an increase in PCO2, and a line like this is a decrease in PCO2. So right now we're right here with no compensation. So how can your body increase your CO2 in order to lower the pH? Okay, so this might give you a clue. Okay, so to increase the concentration of CO2, your body can stop breathing the CO2 out or start hypoventilating. So if you have a metabolic alkalosis, your body will compensate by slowing your breathing, keeping more CO2 in, and this line will then shift to this imaginary PCO2 of, let's say, 50 right here. And that is a partially compensated, okay, metabolic alkalosis. And the lungs are really what compensate for that. Okay, with a fully compensated, okay, metabolic alkalosis, your body continues to slow its breathing, okay, and then the line goes right here. Let's say it's a PCO2 of 60 instead of 50 or 40. Okay, so now the increased concentration of CO2 in your blood is making up for the increased level of bicarbonate in your blood, and your pH is normal even though those two values are abnormal.